great pleasure to join all of you this morning in discussing what we can do, certainly all of our organizations and our communities, to help people live healthier lives. This month really has significant importance to my office, the Office of Minority Health. Not only is February American Heart Month, but it's also African American History. And both of these observances really present opportunities for us, certainly to champion the advocates, the pioneers, the innovators, both past and present. And it serves as an opportunity for us to really shine a light on how far we've come, but certainly how much further we have to go. For all that's been achieved in cardiovascular disease and healthcare, there remains much more research to be done, and certainly the questions that I've heard here in the last panel have highlighted that. There are more practices to be perfected and more awareness to be raised. And for all that has been achieved in realizing this American promise of opportunity, there remains so much more to be done. But that knowledge that our mission remains relevant, that our work remains necessary, and that our priorities are more urgent than ever is truly the driving force behind my work each and every day. At the Office of Minority Health, our mission is to improve the health of racial and ethnic minority populations through the development of programs and policies that will help us eliminate health disparities. And that's been our charge since the office was established in 1986. Because even now, almost 50 years after the signing of the Civil Rights Act and the creation of Medicare and Medicaid, health disparities persist. Ours is a nation certainly that's burdened by health disparities for far too long. And I'm sure you've heard many of these statistics and many of these facts, but I'm the daughter of two teachers from Haiti, and so they tell me repetition helps. So I'm going to repeat some of these things to you today. Minorities are less likely to get the preventive care that they need to stay healthy. And although minorities represent 1/3 of the U.S. population, they represent more than 1/2 of the uninsured. And so when they get sick, they're less likely to have access to quality health care. Minorities are more likely to suffer from chronic disease and heart disease. The very reason that we're here today is an especially telling example. Cardiovascular disease represents the largest proportion of inequality in life expectancy between African Americans and non-Hispanic whites. And as the American Heart Association has reported, disparities exist in every aspect of stroke care, from lack of awareness about risk factors and symptoms, to access to preventive treatment, emergency care, and resources for recovery. As a pediatrician, this is especially troubling for me as I saw the rising disparity of obesity, high blood pressure, and high cholesterol in my adolescent patients who were predominantly minority. And I worried about their future as far as their health and their well-being as adults. These were supposed to be the health challenges that we saw in adult patients, but they were becoming more and more commonplace in our pediatrics practice. The consequences of these disparities are also especially acute among women of color, who are more likely to have multiple risk factors for heart disease, such as high blood pressure, diabetes, and obesity. Yet they're less likely to be aware of heart attack symptoms and the need to call 911 when those symptoms arise, meaning that those women most at risk of heart disease are actually least aware of the threat. This realization is actually the motivation for a new initiative, which hopefully many of you are familiar with, that our office at the Department of Health and Human Services, the Office on Women's Health, created, called Make the Call, Don't Miss a Beat. The campaign is a national public education effort that aims to educate, engage, and empower women and their families to recognize the most common symptoms of a heart attack and encourage them to call 911 if they experience any symptoms. Heart disease touches the lives of millions of Americans every year, and many of you have seen that reality for yourselves as providers and caregivers. Some of you have lived it. Each of your stories is proof of the profound impact that heart disease has had on the health of this nation, with a disproportionate burden being borne by minority populations and women. But these are other inequalities in our healthcare system go far beyond being a minority issue or even a healthcare issue. Health disparities are an American issue and signals a deep consequence for our nation's future. That's why the initiatives that you've heard about today from my colleagues at the Department of Health and Human Services, and I see Dr. Janet Wright in the back of the room, and across the federal government are so important. You've heard about the Innovative Million Hearts Initiative, a new public-private partnership committed to preventing 1 million heart attacks and strokes over the next 5 years, which complements important work such as the American Heart Association's Go Red for Women and Soulmates. You also heard about the Affordable Care Act, the new healthcare law, which is transforming our healthcare system with particular opportunities and benefits for the health of minorities and women. First, by expanding access to preventive care, the Affordable Care Act will help reduce the impact of diseases that are disproportionately impacting minority groups. It's often the cost of preventive services, with cost sharing such as co-pays and deductibles, that serve as barriers to accessing preventive care. But the new healthcare law makes healthcare more affordable. Let's take, for example, obesity, which impacts minorities at far greater levels than their white counterparts. Under the Affordable Care Act, health plans will be required to cover recommended preventive services for free, such as screening for obesity, blood pressure screening, and tests to screen for conditions like high cholesterol and diabetes. Second, the new healthcare law will also increase the availability of healthcare and will help us reduce disparities that we see in access to care. In 2009, nearly 19 million people who were served in community health centers that are funded by one of our agencies, the Health Resources and Services Administration, were served, and more than half, nearly 2/3 of those patients were minorities. What the Affordable Care Act will do is provide $11 billion over the next 5 years to strengthen and expand those community health centers. The Affordable Care Act will also help us with our infrastructure of our health system to better address health disparities. It created 6 new offices of minority health in agencies throughout HHS, and it also elevated the National Center on Minority Health and Health Disparities to become a full-fledged NIH institute. This means that we have offices of minority health really working together across our department. It's an unparalleled leadership and infrastructure opportunity for us to really advance and move the work that we're doing in minority health and health disparities. And I think it's so critical for us to understand where that leadership is, that the 6 agencies that have these offices now are the Agency for Healthcare, Agency for Research and Healthcare Quality, the Centers for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, the Food and Drug Administration, the Health Resources and Services Administration, and the Substance Abuse and Mental Health Services Administration. We also know that women, as we've talked about here, have unique healthcare needs, and that women often have to make the healthcare decisions for their families. And the Affordable Care Act offers important benefits for women and their families. It protects women by providing insurance options and lowering costs. For years, women have gotten really a bad deal in the insurance market, and women are more likely to be uninsured or underinsured. And the new healthcare law creates equality for women in the health insurance market. Women insurance companies can't deny coverage to women. Before the health insurance law, new insurance companies could deny individual policies to women due to pre-existing conditions, such as having cancer or having been pregnant. In 2014, it will be illegal for insurance companies to discriminate against anyone because of a pre-existing condition. Women have also had to pay higher health care costs. Before the law, they could be charged individual insurance premiums that could be as much as 150% the premium for that same age male. In 2014, insurance premiums will not be able to charge women higher premiums than they charge men just because they're women. So you see, with the Affordable Care Act, we're driving change across healthcare, and we see a tremendous window of opportunity to address disparities and achieve health equity. But also within this last year, this moment of opportunity has really grown for us through the promise of 2 announcements of 2 strategic initiatives, the HHS Disparities Action Plan and the National Stakeholder Strategy. Both initiatives that I know that the American Heart Association has publicly supported, and I thank you for that support. Under the leadership of Secretary Sebelius, HHS has released its first ever HHS Action Plan to reduce racial and ethnic health disparities, and it builds on the strong foundation of the Affordable Care Act. What this Disparities Action Plan does is it really reaffirms our department's commitment to helping all people reach their full potential for health and achieve a nation that is free of disparities in health and health care. It aligns our work with programs such as the First Lady's Let's Move initiative, which I know you'll hear about later this afternoon, the President's National HIV/AIDS Strategy, and Healthy People 2020. And what the action plan does is it really helps us to focus on the impact that we'll have on disparities whenever we make decisions about our programs and our policies. The plan includes a number of actions, including expanding access to care through our health centers, providing incentives to adopt electronic health records, to connect people to care through community health workers, to fund tobacco cessation programs and strengthen our data collection, as well as to strengthen and increase the cultural competency of our healthcare workforce. The Office of Minority Health also coordinates the National Partnership for Action. This was established to really mobilize a nationwide, community-driven approach to combating health disparities. The National Stakeholder Strategy for Achieving Health Equity was developed from the input of thousands of individuals from across the country, really helping to guide action at the community level. So these are communities responding through their leadership to address how they will tackle health disparities in their area. There are now 10 regional health equity councils across the country, comprised of and chaired by community leaders who represent a diverse array of sectors. Health, business, education, environmental justice, all working together to address the determinants of health, where people live, where people learn, where people play, where people work, in order for us to achieve health equity. And I will note that we do have cardiologists and other providers on those councils, so the cardiovascular message is certainly at the forefront in these councils. The Affordable Care Act, the Disparities Action Plan, and the National Stakeholder Strategy, these are just 3 plans that we have, but these are not plans that are going to sit on a shelf and collect dust. They certainly have high expectations and tough standards, and they're holding all of us accountable, from policymakers to providers, to be accountable to meeting our benchmarks. They outline a critical opportunity, a window of opportunity for us to align our leadership and our resources